and welcome to, what is it today? Day 24, 25? I've lost count completely of what day of lockdown this is. I am really excited this morning. I'm Projeni, and I'm the Managing Director of Exposure Marketing and the founder of Mama Magic. And today I am speaking to somebody very special, actually, who's been a client of ours for very many years. And we are so excited to be able to talk about it to all of you, especially those of you who don't know about stem cell storage. So today we're talking to Shelley, who's the managing of Netcells, to have stem cell storage done when you were pregnant. So we're just waiting from Netcells. And if you've got any questions that you'd like to ask, and those burning questions that you wanted to ask about stem cell storage, well, now's the time. Shelley's an expert from Netcells. She's been with them for many years, and she has been guiding the company for the past few years, and she can tell you all about it. I know it's been a burning topic, and especially now with COVID-19, I wonder how that goes. Good morning.
Good morning.
Can you hear me all
Yes,
fine?
I can.
Wonderful. Thank you so much for joining us.
You are welcome, and thank you so much for the invite.
It's an absolute pleasure. We're so excited to have you guys with us this morning, and we're so excited to be talking about stem cell storage. I know it's been going on for many years, and I know it's been developing over many years. And but I think there's so much has changed through the time as well. And I think your products have developed, and stem cell storage on its own, compared to how it started many, many years ago, has developed so very much. So firstly, why don't you introduce yourself? Tell us about yourself firstly, and then you can tell us a little about stem cells.
Okay, thank you so much. So my name is Shelley, and I work for Next Biosciences. We are a laboratory and a biomedical company, and we offer a wide range of tests and genetic tests, as well as stem cell storage. And I run the business unit that does the stem cell storage for the company, which is called Netcells. Yeah.
Now,
I want to tell you about myself.
So when did stem cell storage begin in South Africa? When did we introduce it to South Africa?
Okay, so Netcells has been around for 15 years. It originally started when the option was available to bank your stem cells overseas. So there's many stem cell banks that are international. There's hundreds and hundreds of them. And initially, our director decided to make this available to people in South Africa. So she started with offering storage overseas, and then realized, well, why are we doing it overseas when we can do something like that in South Africa? So she developed, we built a lab in South Africa and started offering stem cell storage here. And we've been doing that for the past 15 years.
Wow, that's amazing. Now, I remember in the days when you first began, stem cell storage basically in my head, had one purpose, and that was if somebody in your family got sick and had a disease that you couldn't find cures to, you could actually use the stem cells stored from another member of your family to help that family member. But I mean, you can correct that version, my version of that story, but I know it's expanded so much more than that, just that now, right?
Absolutely. So you're exactly right in terms of why people store their stem cells. So the cord blood stem cells can be used to treat over 80 blood-related disorders. So those are things like sickle cell anemia, thalassemia, leukemia, and those are standard treatments for cord blood stem cells. But throughout the years, we've also started storing stem cells from cord tissue. There's no standard therapies as yet for the stem cells that are found in cord tissue, but they're doing clinical trials all over the world to see what kind of potential they have, and they have huge potential in terms of helping with regeneration. Cord blood, there's also a lot of clinical trials going on at the moment with the use of cord blood in the treatment of things like autism and cerebral palsy. Now, those also aren't standard treatments by any means, clinical trials, so they're trying to understand what potential they have. But in clinical trials, they do see a lot of positives that come out of using cord blood for those treatments. Improvements in the children who have autism in terms of how their ability to communicate. So there's so much that we're still learning in terms of what stem cells can do. Many years ago, it was just as a replacement to a bone marrow transplant. And now they're seeing so many other potential uses, which is absolutely amazing.
That definitely is so. Now, tell me, from all the stem cells that have been stored in South Africa so far, from all the people that have done this, how many of those people have, at this point in time, have had the chance to use those stem cells? Or, well, you don't want that opportunity, it's like taking insurance, right? I suppose, if you describe it like that. You don't really want to be able to be in that position where you have to use it, but when you do need it, it's there.
Absolutely. So we have released three stem cell units for treatment, one locally and two internationally. And we've also got something called our Families of Hope program, which we look at trying to help those who really require a stem cell transplant but don't have the financial means to do it. In situations like this, it will be a child is sick and the parents happen to be pregnant with another child, and we'll bank those stem cells in the hope that they can use them for their sick child. So we've helped a couple of families to be able to bank the stem cells, but unfortunately it's not always a match. When it comes to a sibling has a 1 in 4 chance of being a match. You get half of your genetic material from both of your parents, and you would need the same genetic material to have been passed down to be a match. So there's a 25% chance, but unfortunately that doesn't always happen. But we have seen the use of it. We've got a sister lab in the UK who we work closely with. They've released 21 samples for treatment. So there's lots of releases happening internationally, and we've had 3 at our laboratory.
Okay, that's wonderful. Now tell me, Shelley, in terms of the actual process, it sounds interesting, but it also sounds a bit scary. Like, how are you going to harvest these cells? You make it sound simple, but I mean, when you're pregnant and there's so much else going on and there's so many other things that you need to think about, how exactly do the cells get harvested during birth, right?
Yes. So, very good question, because I know, it does seem like an exceptionally overwhelming process. When you're pregnant, there's so many other things that you're having to worry about that, it is quite daunting thinking of adding another thing to the list. But we try and make the process as seamless and as easy for the parents as possible. So what we do is we try and get parents to register about a month before the baby's born, just to give them time to register, for us to prepare a kit for them. We then courier the kit to the parents so that they've got it with them ready for when they go into labor. And then after that, we've got some videos which we send to our parents just to help understand the kits. We have got 2 amazing ladies in client services who are there for any questions that the parents may have, and we talk them through the process of what's in the kits and what they need to do. But essentially at the birth, we always say we give the responsibility to the dad, because mom has got enough to worry about at the birth, and he just needs to take the kid to the hospital. He takes the kit there and gives it to the gynae or the midwife, whoever's delivering the baby, and says we have chosen to store our stem cells. We have got consultants around the country who have trained the doctors as well as the nursing staff in how to do a stem cell collection. So they are completely aware of what needs to be done, and we've got lots of doctors that have helped us with many, many collections. So literally you hand it over to the gynae, to the midwife, and they will do the collection for you. And it's completely non-invasive. It doesn't hurt at all. It doesn't put the baby or the mom at any risk. The baby will be born, the umbilical cord will be clamped, and then they'll do the collection. So baby can sit with mom, it won't even influence that at all, and they can do the collection.
So does mom feel anything?
Sorry?
Does mom feel anything? Will baby feel anything?
Not a thing. And this is why, the collecting stem cells from cord blood is popular, because it's a non-invasive procedure. All they have to do is, so they clamp the cord, they cut the cord, and then they insert a needle into the umbilical cord vein. So the baby won't feel that, they will no longer be attached to it, and the mom won't feel anything at all. So it is a very painless and simple procedure. Once the cord blood is being collected, we also, if a parent has chosen to store the cord tissue as well, we will cut about 10 to 15 centimeters of the cord tissue, and then that will be sent to us as well for processing.
I see. So why is that part taken, Shelley?
So there's different stem cells that are found in the cord blood versus the cord tissue. So the cord blood, you have blood-forming stem cells. Now, those are used in the treatment of blood-related disorders. So what I mentioned before, sickle cell anemia, thalassemia, leukemia, those types of things. Now, the cord tissue is filled with something called mesenchymal stem cells. Now, these are different types of stem cells to the ones found in cord blood, because they form the connective tissues of the body. So things like skin, nerves, bone, cartilage, those types of things, they would then have the potential to help with regeneration of those connective tissues in the body. And that is what scientists are busy researching with clinical trials, to understand the true potential of those cord tissue stem cells. So they do serve two different purposes.
I see. Now, where exactly does it go from that point? So it's collected and goes to your lab, right?
Yes. So as soon as the birth has taken place and the collection has been done, we ask our parents to give us a call to let us know that the baby's been born. We then arrange for a courier to go and collect the stem cells, the stem cell kit from the parents at the hospital. And then it comes back to our laboratory in Midrand, where we do the processing from here. So we will process within 48 to 72 hours after the birth of the baby. We've got amazing ladies that work in our laboratory who extract the stem cells, and then we actually store just the stem cells from the cord tissue and then from the cord blood in our tanks that we have here. And they are cryogenic tanks, so they are stored using liquid nitrogen, and they're stored at about minus 196 degrees. So they are preserved for when they might be needed.
Okay, so there's a question from Marge here that I see. Can it be performed post-clamping, so post the pregnancy? Can it be done after?
Yes. So I know that there's a lot of research out there about delayed cord clamping and the benefits of it, and you most certainly can do both. So what the guidelines say is that they recommend that if you would like to do delayed cord clamping and stem cell banking, that you delay the cord clamping for 60 seconds, but no more than that. And they say that in those 60 seconds, about 80% of the blood does return to the baby. So, and it does ensure a safe outcome for the baby, as well as a safe outcome for the stem cell storage. So we do find that if you delay cord clamping of longer than a minute, say 3 minutes, it does significantly impact the amount of blood that you are able to collect and potentially the ability to store the stem cells. But you can do it definitely if you delay cord clamping for up to 60 seconds.
Okay. Shelley, so now after this is all done, and our stem cells have been stored with you guys, you have it all, what happens thereafter? I mean, is there any communication between Netcells or the stem cell storage company and the individual?
Yes, absolutely. So what we do, I mean, we will inform you straight after, we'll inform you when we receive the stem cells, we inform you when the stem cells have been safely stored, and we'll provide you with a storage certificate as well as a result certificate to say that everything was successful. Thereafter, we just try and keep up to date with our parents and let them know what kind of news is out there in the industry and in just in terms of what's happening. So we send out a newsletter a few times a year just to touch base, make sure that the parents understand what's going on. We do ask that if any information for the parents change, that they let us know so that we can ensure that we keep up to date and we continue to be in contact.
Okay. And so when I want my stem cells now, at what point do I determine as a parent that I need my stem cells? Or, because I mean, you could forget, it could be many, many years later, right? So do doctors ask you these questions? Yeah, how does that work?
Okay, so what happens is, you know, when we've needed to retrieve stem cells, what we need is a request from the parents as well as a request from the doctor to be able to use the stem cells. So inevitably when you need them, you would have been in contact with a doctor and discussing the options and explaining that you do have stem cells stored which could be used. The doctor feels that they can use them, then they will just inform us as well as the parents can inform us that they need the stem cells. We will then make sure that we get all the paperwork that's necessary and we will help to facilitate getting the stem cells to the treatment facility.
Okay, so we have another question here by captured by Nicole Photography. She says, hi, my baby only has 2 umbilical cord vessels. Does that have any impact on the stem cells or the cord blood?
I'm not too sure I understand the question in terms of 2 umbilical cord vessels.
She calls them SUA. That's what she's typed in here.
So what I'll do is, I think that is quite a medical question.
Okay.
And I will actually get our medical director. If I can get that information from you, I can pass it on to our medical director and she will be able to give us a bit more information about that.
Okay, sure. So we'll get back to you with that one.
Absolutely.
And Netcells has a host of experts, I think, who have can take you through all the technical details. Sure, there's very individual cases, and that a lot of mums have questions about because, you know, as much as pregnancy, most women go through it, but there are very unique circumstances around each pregnancy as well. And I'm sure you have all the questions, answers to those questions as well. So we talked about, so Shelley, if I had to say, you know, what would be the most important reason in this day and age for a mum and dad to make sure that they capture their baby stem cells?
So in terms of, you know, making the decision to decide to store your stem cells, we do understand that that is a very personal decision based on what the parents decide. But essentially, you know, storing your stem cells is, as we've said before, it's a form of medical insurance. So you really do hope that you'll never have to use them and that your children will be healthy. But should they need them, you've got the stem cells there. The reason that you store stem cells in a private bank is that you store them for the use of that child or potentially a family member if they are a match. So, you know, again, it's a medical insurance. because you've got those stem cells for your family, and definitely for that child, because you know that it is a 100% match for your baby.
Okay.
When
Next question, Shelley, sorry, 1 second. Shelley, before she goes away, I just do want to, whilst you're going through that question, take us through again. She says, you know, she's missed that first part, I think. What are those stem cells used for at a later stage? So whilst I know this could be part of that question as well.
Okay, so essentially, when you store your stem cells, it can be used for the treatment of over 80 blood-related disorders. So used in the treatment for things like thalassemia, sickle cell anemia, leukemia, and there's a very long list, which is also available on our website if anyone would like to see. Now, when you are storing the stem cells for your child, that is a 100% match for your child. So whenever you're needing stem cells or a bone marrow transplant, usually what happens is that you'll have to go onto a registry in order to find a match. It is quite difficult to find a match, and for the general population, it's about a 1 in 100,000 chance of finding a match. And then for people of mixed ethnic descent, the chance is about 1 in 400,000. So we don't have a very big representation on a registry of a lot of different samples and a lot of different matches to be able to provide matches to everyone. So you store for your child so that if you ever have to need it, you know that it is a 100% match for that baby.
Okay.
That being said, it is important to note that if there is a genetic reason for why the baby is sick, so something like thalassemia is a genetic condition, and they would not be able to use their own stem cells for their treatments, but they may be able to use the stem cells from their siblings. So that's why we also encourage parents to store for both children, because instead of a 1 in 100,000 chance, there's a 1 in 4 chance of being a match to your child. Okay. The benefits also of cord blood stem cells is that you don't need a 100% match to be able to use it. So there's markers that they determine if you are a match, and there are 8 markers. Normally you need an 8 out of 8 in order to be able to use a donor for a transplant. But with this, you need a match of 6 out of the 8 markers. So that is quite beneficial for the parents and hopefully whoever needs to use it.
Okay, and then one last question we have here from Lala Cronier, and she says, I think it's probably a burning question and for everybody as well, is what is the cost of it, or thereabouts, and does the cells ever expire? And I mean, is it a once-off cost? Do I have to pay, you know, every year like I do, or every month with insurance?
So we've actually got various options in terms of payment. So firstly, just to answer the question in terms of the lifespan of the stem cells, there is no reason why stem cells shouldn't last for the lifetime of a child. They are preserved and preserved at a very low temperature, so they should last the lifetime. But what we can tell you is that there has been evidence and proof that the stem cells last at least 23 and a half years. So what they've done is they've taken stem cells out after that amount of time and tested them to see if they're still viable. So we know for a fact that they will last 23 and a half years, and that's the information that we give to our parents. But we do know that there shouldn't be a reason why they wouldn't last a lifetime of a child, but we have scientific proof of 23 and a half years. Now, we understand that the payments associated with stem cells, that it's not a very, it's a fairly expensive service, should I put it that way? And what we try and do is we try and make it more accessible to our parents. So we've got 3 different options in terms of payments. We've got upfront payments. So with that, you pay a registration fee, you pay a processing fee, and you pay a storage fee. So those are the 3 fees associated with it. If you pay upfront, you can pay the full fee upfront. We also have an option where you pay the registration fee first, and then once the stem cells are successfully banked, you'll pay the remainder. Then what we also have is we've got payment plan options, because we understand that not everyone has got the money upfront to be able to store their stem cells. So we offer 12, 24, and 60-month payment plans, and they are interest free.
That's wonderful. That is really, really awesome, I think, because that allows a lot more people to have access to it. And like we're saying, I think it's just something that if you have the opportunity to do, that you should. I mean, it would be wonderful if we had stem cells that could help us through COVID, right?
Oh, it would be amazing, yes. Unfortunately, we're just not quite there yet, but maybe one day.
Yep, who knows what the future holds. That is
Yeah,
so true. Yeah,
yeah.
that is so true. Well, Shelley, thank you so much for joining us this morning. We really, really appreciate all the information that you've given us. Like Shelley said, all that information is available on the Netcells website as well. They have a range of experts and staff that will be able to hold your hand and definitely guide you through the process. They're an absolutely warm team that is so easy to deal with. We've been dealing with them, and they've been servicing all our Mama Magic mums that have had their babies over the past 15 years. And it's been wonderful, wonderful for all of them. Like I said, I've been exceptionally envious, but maybe one day my children would be able to go through this process and store their babies' stem cells as well. And the process has been refined. So yes, you can message us and we'll give you more information. If you have any personal questions for Shelley, you can message Netcells directly, or you can message Mama Magic, and we'll provide you with all the information you need. Shelley, thank you for joining us. Be safe, take care, and we look forward to seeing you very soon.
Yes, likewise, and thank you very much for having me. Keep
Thank
safe
you.
as well.
Thank you so much. So to all our mums out there and dads, thank you for joining us this morning. Stay safe, stay strong, and stay home. Thank you, Shelley, and thank you all.
Projeni.